Hello everyone, Dr. PK. Today we'll talk about a very common group of heart and blood pressure medication called calcium channel blockers. My last video was about beta blockers. So many people take medications like Amlodipine, Diltiazem, or Verapamil, but don't fully understand how they work and who should take them and what are the long-term risks. So let's break it down very clearly. So what are calcium channel blockers? Calcium channel blockers block calcium from entering heart muscles or blood vessels, muscle cells. That's why they're called calcium channel blocker. Less calcium entering into the heart muscles and blood vessels, muscle cells means blood vessels will relax because calcium causes contraction and blood pressure goes down. The heart may beat slower with less force. There are two types of calcium channel blockers. One is called dihydropyridines. Examples include amlodipine, nifedipine, felodipine. What they do, they act mainly on blood vessels, strong blood pressure lowering effect, minimal effect on the heart rate. Common use, high blood pressure, angina, and older adults with stiff arteries. Non-dihydropyridines. Examples, the two mainly we use, Verapamil and Diltiazem. What they do, they slow the heart rate. So they work on the heart and they reduce heart workload. They control abnormal rhythm. Common use, atrial fibrillation. Diltiazem is often used for atrial fibrillation. Supraventricular tachycardia, angina, and blood pressure control in selected patients. Usually we combine it when there is a high blood pressure or arrhythmia in that case. Indication, high blood pressure, chest pain, angina, heart rhythm disorder, Raynaud's phenomenon, patient who cannot tolerate ACE inhibitors. Common side effect, amlodipine type of medicine, leg or ankle swelling, and usually with higher dose of amlodipine, headache because blood vessels dilatation, flushing sensation, dizziness. Verapamil and diltiazem, it causes slow pulse, so it will cause fatigue, constipation because relaxation of intestinal muscles, low blood pressure. Contraindication, who should avoid it? Avoid or use caution if you have very slow heart rate or if you're taking beta blocker like metoprolol or atenolol. There'll be double blocking and cause severe slowing of heart rate. People with a heart block problem, people with a severe heart failure, they should be careful in considering verapamil and diltiazem. Beta blocker is much better option like a metoprolol or carvedilol. Combination with a beta blocker without supervision with your cardiologist and internist is not advised. I have few patients who are on both medication. Long-term use, is it safe? Yes, calcium channel blockers are safe for long-term use in most patients. They do not harm kidney. They do not worsen diabetes. They do not raise potassium. Long-term concern is only persistent leg swelling in case of amlodipine or nifedipine or constipation. Sometimes excess heart rate slowing because of verapamil or diltiazem. So final takeaway is calcium channel blockers are effective, well-studied, commonly used medication. The key is choosing the right type for the right kind of patient. So that's where your doctor and your cardiologist comes into play, and they will select the right kind of medication which is going to help you and live longer. So thank you for watching. Happy holidays. Merry Christmas. See you next video.